Hi guys, welcome to my presentation. My name is Ariel Divine Washington and I am going to be explaining the endocrine system. Let's get started. First, we are going to answer the question, what is the endocrine system? The endocrine system includes all of the glands of the body and the hormones produced by those glands. It is one of the body's primary communicating, regulating, and coordinating systems. If you can kind of see this image, it tells us what the endocrine system consists of in our body. The first thing is the hypothalamus. Then we have the pineal gland, the pituitary gland, the thyroid gland, the thymus gland, the liver, the stomach, the duodenum, the pancreas, our adrenal glands, kidneys, and in a woman we have ovaries, the placenta, and the uterus. And in the man, we have the testes. Diagnostic tests and procedures associated with endocrinology. The first thing on our list is the Sestambi scan. The Sestambi scan is a nuclear medicine scan that detects abnormally enlarged parathyroid glands after radioactive dye is injected into the bloodstream. These scans are usually repeated a few times throughout the day for as long as the patient is in the hospital. And the next one is something that most of us are familiar to is ultrasounds. An ultrasound uses sound waves to detect masses or fluid in soft tissues. They're useful for evaluating thyroid nodules, lymph nodes in the neck, and can identify enlarged parathyroid glands. It's also used for something for us females when we are pregnant, which is to either identify the baby or make sure the baby is developing correctly. Back on topic, the next one is positron emission test, also known as PET scanning. The PET scanning can be used to image thyroid cancers that do not take up radioactive iodine. Our last one is fasting blood glucose, also known as FBG. The FBG test is a test that measures glucose levels in the blood after the patient has fasted for at least 8 hours. Used to, oh, sorry. The FBG is also used to diagnose pancreatic disorders such as diabetes and hypoglycemia. Medical surgical procedures that are associated with endocrinology. The first one is lobectomy. Lobectomy is the removal of one lobe in treatment of endocrine diseases such as hyperthyroidism. The next one is thymectomy. Sorry. Thymectomy is the excision of the thymus gland in cases of myasthenia gravis or a tumor. Next, we have thyroidectomy. Thyroidectomy is the removal of a portion of the thyroid gland by surgery, often performed for reasons such as thyroid nodules, thyroid cyst, Gautier, Graves' disease, hyperthyroidism, and thyroid cancer. In most cases, surgery consists of removal of one side of the thyroid, which is called thyroid lobectomy, or all of the thyroid, which is called total thyroidectomy. Some medical vocabulary terms for this system that are used a lot is thyroid megaly, which is the enlargement of the thyroid gland. Endocrinologists. Endocrinologists are specially trained physicians who diagnose diseases related to the glands and related to the endocrine system, of course. Hormone. Hormones are a regulatory substance produced in an organism and transported in tissue fluids such as blood or sap to stimulate specific cells or tissues into action. Next, we have metabolism. The metabolism is the chemical process that occurs in the body in order to maintain life and a good amount of energy by burning off fuel from food to release energy in cells. Lastly, we have homeostasis. Homeostasis is the process in the body that maintains a constant internal environment like body temperature and blood sugar levels. Metabolism and homeostasis are often confused for one another and are said to be the same thing, which I don't get because they're two completely different things. So keep that in mind. One is for energy and burning the food, and the other is for keeping your, like I said, the body temperature, blood sugar levels, you know, heart attacks and all that, and keeping them constant so they're not leading up to diseases and, attacks. So keep that in mind. They're two different things. Some abbreviations that I thought were important to know that are associated with this system. One is GH, which stands for growth hormone, and that is a hormone that stimulates growth, and it's produced by the pituitary glands. Next, we have TFT, which stands for thyroid function test. TFT is also known as the T3 test. And basically what that does is checks for levels of the hormone triiodothyronin. Sorry, that is really hard to say. Which is a hormone produced by the thyroid gland and affects almost every process in the body, including body temperature, growth, and heart rate. Next, we have HRT, which stands for hormone replacement therapy. And this is basically a treatment with estrogens that aim to reduce menopausal symptoms or osteoporosis. Next, we have TSH, which is thyroid stimulating hormone, or another word for thyrotropin. And basically, it's another hormone in the pituitary gland that regulates production of thyroid hormones. Next, we have BS, which stands for blood sugar, which is the concentration of glucose in the blood. And lastly, we have FBG, which is fasting blood glucose. We learned about this one in a few slides back, but it is basically a test to see if you have diabetes. End of my presentation. I hope you enjoyed it and learned a lot about the endocrine system. If you have more questions that I didn't answer in this video, these are the websites that I got my information from. One of them is not highlighted. I see it didn't do that, but here it is right here. So I suggest that you check these out if you have any more, or if you want any more information based on the endocrine system. Thank you guys for watching. Have a good day or night wherever you are. Bye.